green crack, super silver diesel haze, and Snowberry. Just 3 names given to the cannabis being legally used in New Mexico to treat anything from cancer to chronic pain to post-traumatic stress disorder.
People like who either are suffering from pain, want something to help them sleep, want something to really kick them in the head. You have to have indicas. We grow sativas for people who want that happy high.
Mandy Denson co-owns Compassionate Distributors dispensary in Ruidoso. She is a seasoned professional when it comes to strains and types of medical cannabis and the different kinds of relief they can facilitate. But she wasn't always. It wasn't until she saw her husband struggle with a major work injury that she really witnessed the medicinal benefits of marijuana.
My husband had an accident where he shattered both of his heels. He worked construction and he was told that he would not work again and maybe not even walk again.
The painkillers he was prescribed made it impossible for him to concentrate, and he often felt sick to his stomach and had difficulty sleeping.
He found that if he was able to smoke, he wouldn't have to rely upon the pain medications. And so he was able to get completely off of the pain medications, become his usual self again.
Denson and her husband weren't alone. She found that a lot of people in the area were self-medicating with marijuana they were buying off the street. So in 2011, they opened a dispensary in southeast New Mexico so people could medicate legally and access medicine grown to address their specific health conditions.
The general response, and I see most of it from patients, is just overwhelmingly positive. Every time I'm down there, I just have people thank us.
3 years later, Denson says with steep annual state fees and limits on how many marijuana plants they can grow, there's only so much that they've been able to do to provide patients access to the effective medicine.
Producers were running out or having to limit the amounts that they were selling to patients because they couldn't grow enough.
Proposed changes to the New Mexico Medicinal program could increase the number of plants producers can grow from 150 plants to 450 at a time. Denson says given the number of patients who can't access the medicine they've been prescribed, there should be no plant limits.
If they would give us a bigger plant count, we not only would be able to grow more, but we could do it more economically, which means we could lower our prices.
Denson says getting marijuana through the state medicinal program is already so expensive that some patients have to buy it on the black market.
Also in the rules and regulations from Department of Health is a prohibition against allowing for volume discounts. So I could sell you something for $12.50 a gram, and if you wanted an ounce for it, it's still going to be priced to you at $12.50 a gram.
Denson says some patients are effectively putting their health in the hands of local drug dealers. They can't be sure of what they're getting or the effect it will have on their medical condition.
With the recreational market, you have limited availability of the strains that are coming through the area. So 1 week you may have something that is very effective for helping you go to sleep because it's more indica dominant. The next week you might have something come through that's more sativa and you try smoking it and you can't go to sleep because that's not the nature of it.
The Department of Health is proposing testing to better regulate and homogenize medicinal cannabis patients are using, and Denson says that needs to happen. But with all the limitations and fees restricting medicinal marijuana's growth and supply in the state, most dispensaries won't be able to pay for the testing to continue supplying medicinal cannabis to those that need it.
We're still paying off our debt that we incurred to start this operation, but once the debt is paid off, if we do have a surplus, which is a nonprofit term for a profit, we can pay that out in the form of subsidizing medicine for people who are low income.
Denison says if proposed changes to triple annual dispensary fees go through, it would further complicate medicinal access. But she says they will still stay in business. For KRWG, I'm Simon Thompson.